Next, from the Union League Club of Chicago, we talk with a business consultant with an expertise in fighting fraud. We'll hear how illegal operations can rob taxpayers of billions of dollars in fraudulent medical bills to government. We'll also get some ideas on how businesses and individuals can avoid becoming a victim of fraud. This runs about 20 minutes.
Rebecca Bush with Medical Business Associates, thanks for joining us on the Illinois Channel.
Thank you for having me.
You deal with fraud within medicine, and everyone knows the state of Illinois is spending massive amounts of money on health care. It's one of the leading reasons why the state is in financial problems aside from pension costs. No one really knows exactly how much fraud there is within the medical expenditures, but do you have any sense based upon investigations or just statistics within your field that would lead us to have any kind of an idea of how pervasive fraud is?
Well, healthcare fraud, if you look at many of the different published studies, they estimate that about 10% of all claims that are paid are misrepresented. So either outright false or upcoded, inflated in some sort or form of fashion. That's just one piece of it. Then there's the other attributes of it that have to do with our Medicaid program, people who are participating in the program that are not eligible. So it's varying degrees of behaviors and abuse that are occurring within our programs. And that's just Medicaid. And I think you mentioned in Illinois, but then there's also all the employees that are part of the state program as well. That's also part of our budget.
Before we go into get a little more in depth on that, but let's lay the foundation a little bit about your own background and how is it that you came to have the position you do where you are dealing with the issues of fraud in medicine?
It was an eclectic pathway, and none of it, of course, with most things in life, it was not planned. But I started off as an adult intensive care medical nurse and fell into this whole role of auditing, working as a medical auditor for a hospital, then insurance companies, and it just kind of progressed from there. And so when you're looking at compliance audits and you're comparing one thing to another, of course you start to get activities that would be considered kind of the gray area, and then without question activities that push the envelope and just cross that line into that whole waste, fraud, and abuse arena.
I take it when you were working in these different positions that all of a sudden you would see things that kind of made your jaw drop?
You know what? The first time I saw something, it made my jaw drop, and I will tell you, as I tell students in my classes or when I'm working with clients, there is not 1 year where I don't experience a jaw-dropping experience. How about that?
Still?
I'll leave it at that, yes.
And how many years now have you been in this field?
Over 20 years.
What are some of the, give us an example of some of the egregious things that you've come across.
There's two varying levels of egregiousness, okay? And the first one I'm going to describe to you is really more from my nursing hat perspective. And that is when I see a provider, there's something called like a rent-a-patient scheme where you rent patients and do things to them. So when I envision a healthcare professional making an incision and performing services on someone that they don't need, to me, it's beyond words because it's a physical assault. And I don't know what it is about dentists when I hear about dental cases and Medicaid children, it just turns my stomach. So that's one level of it, okay? Because healthcare for me, it's a personal, intimate experience. I mean, how many people get up in the morning and say, oh, I'm excited to go see my doctor today, right? Or they've been diagnosed with cancer or some kind of healthcare crisis. So that's one part, okay? The second part would be just the pure abuse or activities that just don't make any sense. So for example, why are we paying a doctor to do surgery 1 per minute? So there's just volume activities.
Let's back that up again because people, why are we paying a doctor to do what?
1 surgery per minute. Like if you looked at the numbers and you see someone when they submit their bills and you just add it up at the end of the day and you do the math and it looks like they're doing surgery at 1 patient per minute. How can that be?
How is it possible that, it's not obviously possible they can be doing that, but how is it possible that they even think they can get away with reporting such things?
How can they, well, it's not so much that they think, It's that people do it, right? You submit a claim, you send it to the mail or you send it electronically, and you get a check. I mean, it's that simple. So the reason why people do it and get away with it is, or why they continue to do it, is because they continue to submit bills and someone continues to send them a check. I mean, it's a direct cause and effect, and the volume of activity is sometimes surprising. The other area that you sit back and look at is, why do deceased patients get services? Why are there deceased doctors out there treating people? So if you look at the claims data, if you look at what's happening, you know, in that process, how are these people getting paid? Those are the big questions. And so, you know, that's why I separated into two categories. One is the very serious side, and the other is like the nonsensical component of it all.
Let's talk a little bit again. So we had a little bit of your background, and how are you utilizing your knowledge? Are you hired to investigate fraud, or do you, what is it actually that your firm does?
Well, there's a couple things. Our firm is a blend of different types of clinical people, so doctor, nurses, pharmacists, and they understand the business of healthcare. So when I walk into a hospital or I'm looking at a set of medical records, I understand the services being provided, the equipment, the supplies, and so forth. I can read a health assessment and appreciate its content. Then what we do is we teach the finance, so the money side, internal controls, your traditional audit functions, and then fraud examination when we're looking at information for not just errors, because you do have mistakes, there are errors that occur, but then we're also looking for behaviors that are clearly beyond abuse and cross that line of intentionally taking something, is how I like to define fraud, intentionally taking something that doesn't belong to you. So it's a blend of those skill sets and expertise that kind of put us out there. So we'll work with attorneys who have a whistle. We do a lot of whistleblower cases, relator cases is what they call them. People who are coming forward and saying, hey, you know, I see something wrong, and they report it. And then we have clients, actually providers. We've worked with insurance companies that want us to come in and say, hey, please look for any vulnerabilities. Do we have the right internal controls in place to prevent something from happening?
It sounds as if the problem is that we've created these systems, but we just don't have, as you say, internal controls. We don't have the proper controls within government. Have you come up with any ideas over the years of looking at this kind of illegal activity, about what government could do to cut down on waste and fraud and abuse, as I said?
You know, that's a dangerous question. We could be here for hours. I think it's in general, not just government, but just when we're handling claims. One of the reasons, for example, that we have the problems that we do is that there's pockets of data and they're not connected. So there's no question we are not leveraging technology. So when I gave you an earlier example of why is a dead doctor getting a payment for rendering services, well, the disconnect is, are we effectively using technology to screen the Social Security Death Index? So when a claim comes in, are we double checking to see if the patient's alive? You know, is a physician alive? I had one legal matter that I was retained on as an expert that we were kind of amused to see how the doctor was going to explain this, but he had all these entries on giving a patient facet injections with results, blood pressure, heart rate, writing down all of these things, and he had died the month before, okay? And so, you know, you look at this disconnect, and that's a simple check, okay? It's a simple check to just screen it against the Social Security Index. So there's many attributes like that, connecting data, that we could use just to get rid of the low-hanging fruit, because that's low-hanging fruit, all right? I did provide some testimony to the folks in Springfield because there was some questions, some mystery. Do we really have healthcare fraud occurring in the state of Illinois. And of course, I raised my hand. It's like, I'd be happy to come down and explain that, yes, we do. But a great question I got from one of our own reps was, hey, can you tell me why a patient would come to our hospital and have a Blue Cross Blue Shield card and a Medicaid card? And I just looked at her and I said, well, have a seat, let's talk about it. But that tells me in a very simple arena that how we accept applications for Medicaid, there's a disconnect. So someone...
And when you say a disconnect, what do you mean?
Well, there's a lack of internal controls in the application process, the information that they're filling out, and then verifying if what is being said in the application is correct. So Medicaid is a recipient program. All right, so you shouldn't be living, you know, in let's just say a $2-3 million home, driving a Lexus, and have a Medicaid card. There's a disconnect there. So something happened in our internal controls to verify the application. That's where the source of the problem would be in that type of scenario, without question.
And again, I asked you, so one thing, you know, we can go to the gas station and swipe our credit card, and within 2 or 3 seconds, the gas station or gas company will know, or the Visa will know that it's us and approve the purchase.
Right. And they even ask you to enter your zip code, right?
Right.
Of the billing address.
Exactly.
Some
So they're
kind
cross-checking. And you're saying that's exactly the kind of thing where they cross-check to say, if someone stole my card, they probably don't know the zip code.
That's right.
Why can't we have that kind of a cross-check of information?
Well, we can. We can do many things. But at some point in the process, for example, we most likely have to upgrade the technology that we use, the systems that we use. You know, we've read you know, publications.
Integrate the databases.
And create the databases. We've read, you know, publications about, you know, outdated equipment, software applications, screening, competency, how many people, you know, do we have available to appropriately screen and review. And so technology is, without question, the attribute that we need to leverage desperately.
And to that end, Julie Hamos, who heads the Department of Children and Family Services, which is really the #1 budget line in the Illinois state budget, testified before a committee that her computers are 30 years old.
Yes.
And I've often said, if you had a room full of people and asked how many people are using a computer that's 30 years old,
Yes.
I don't think you would even have one hand go up. But the state of Illinois is using 30-year-old computers.
Yes. They have their job cut out for them.
You said as far as the fraud, is it coming from hospitals, from providers, from vendors? Is it all the above?
It's all the above across the board, and it also includes recipients. It includes people sharing identities, people stealing identities, and going into a healthcare system under someone else's name. The other thing that's a little bit scary that's not really on the radar is the amount of organized crime entering healthcare. And it's voluminous. And
when has this started happening? I never heard of this.
You've never heard of this? Oh, it's been going on for decades. I'll give you an example. I had one audit where we were reconciling, because that's what we do, reconcile data, and I had an 8-month pregnant woman, and the volume of narcotics that she was taking, what was being billed in her name, was so high that I would expect a 6'5", 250-pound man to drop, okay? So when we started following the data, we found out that, in essence, what happened was a 2-layered owned Nigerian-based pharmacy was just using her identity to bill medications or narcotics. So they were just using her identity. So they're twofold. One is you have identities being used to purchase prescription drugs, that certain types of drugs that will then later be sold on the streets or diverted. And that's a perfect example of how you can reconcile data. Hey, tell me how many pregnant women I have taking narcotics, OxyContin. They don't need to take that. So that would be an anomaly that should trigger some type of review.
What would you say to lawmakers if there's, you know, again, everyone knows that the state of Illinois has a horrible fiscal situation they're facing.
Yes.
Is there any low-hanging, tell us again some of the low-hanging fruit or things that could be done or that they should be doing, whether in appropriating more money for computer systems or just what should they be doing to cut down on fraud?
At the front line, giving their current employees, investigators, the tools to work with. You cannot begin to process large amounts of data without the right equipment. So one is just basic hardware and software. You shouldn't be using 30-year-old computers. The second part would be appropriate training, all right? And then from there, identifying all the areas of vulnerability. What pieces of data are not connected? So low-hanging fruit, without question, would be how are we using the Social Security Index? How are we using, in our world, we have codes. For example, we have diagnosis codes and procedure codes, which in essence is always telling you a what and a why. So are we using current coding systems? Are we making sure our vendors are using current coding systems? Do we have the controls in place? Because this is something else that I've seen where you send the check in, or you send in the claim, but they're requesting that the check be mailed to a different address. I had a doctor of an MRI center recently, the way he found out that his office manager was embezzling is when there was a squad car at 7 in the morning waiting outside to arrest his office manager. That's not when you want to find out that someone is stealing your patient's information and submitting claims and keeping those checks. You want to find out way before that point.
I understand you tell people that here's my health card, that like all of us, you carry your insurance card along with you, but that this can actually be something that can get us ripped off?
Absolutely. That's your insurance card? Let me ask you this. If you steal someone's wallet, and I'll tell you a story about a young lady. If you steal someone's wallet, how many people are walking around with a $1 to $2 million credit line on a credit card? Because I've asked people, when I've done patient advocacy workshops, I have them pull out their wallet. Which one would you rather go shopping with? Not my Amex card, not my Visa card, not my Discover card, but your insurance benefit card. Okay, at least I am not in that position where I have a couple $1 million credit line on my credit cards, okay? But your health care benefit card, the amount of money that you can steal is unbelievable. And the story that I love, I have teenagers, so using fear as a tactic is not beneath me. But so I have, you know, the story of Miss Sachs is great because the way she found out, just picture this. You're a mom of 4 young children. Your youngest is 4. DCFS knocks on your door wanting to take your children away. And she's like, what? Why? Well, according to our records, you just delivered a baby on methamphetamines. We're here to arrest you and take away your children. And it was a long route, okay, but put the pieces of the puzzle together. The month before, her wallet was stolen. And it was stolen by a known meth user who was pregnant. So when she went into the hospital, she utilized her identification to deliver that baby and left. So medical identity theft is something that is just growing at an amazing rate. And there's a lesson learned. Just like your credit cards, if you get your wallet or purse stolen, you cancel your credit cards, people forget to cancel their benefit card. So again, you know, when you asked me earlier, there's the breadth and scope of healthcare fraud that's occurring is just wide, the magnitude. And as I like to put it, there's no end to the creativity of the ethically challenged. They will find different avenues. So circling back to your question about the state, give them the tools, staff them up, bring in the right people to provide training, and at least get a foundation level of technology going so they can leverage all the data that's out there. That would be a great start. And I endorse it as a taxpayer. Give them what they need to work.
Before we close out, let me just ask you, what would you say is the one thing that people should know about healthcare fraud?
I think what people should appreciate is that they're underestimating the scope of the problem. when they think of healthcare fraud, the first thing they think is the local doctor or hospital ripping somebody off. But it's much more complicated than that. Fraud is a behavior. It's taking something that doesn't belong to you, and it comes in many different forms. So you never think of it as provider fraud. Think of it as healthcare fraud, period, which could occur from a patient perspective, a provider, even a payer insurance company, the program, and all the vendors that support it. It's really complex and layered. So the bottom line is, when you have a contract and when you have health information and you have dollars associated with that, you have an opportunity or a mechanism for theft. So the issue is, understand the mechanism of theft and then seal it. That's the key.
All right, Rebecca Bush, we appreciate you taking the time to talk with us on the Illinois Channel.
Thank you very much. Have a great day.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.